This is John Geaver from MedPage Today. For the next few days, I'll be in Philadelphia for AAAAI, the annual meeting of the American Academy of Allergy, Asthma, and Immunology. I'll be reporting the highlights of the more than 1,000 scientific presentations planned at the meeting. To get a preview, I talked with Dr. Wesley Burks, program chair for this year's event and professor of pediatrics at Duke University.
How long has the meeting been going on, and how many attendees do you expect?
We have over 5,000 people that we anticipate attending the meeting this year. It starts today and will last through next Tuesday. The meeting itself has been going on over 50 years.
And what do the attendees get out of it, the allergists and immunologists who are here by the thousand?
Our goal in organizing the meeting is to provide the best scientific and educational meeting in the world for allergists and immunologists. So the two components are the educational component to try to provide up-to-date information, knowledge for the people taking care of patients in their own community. And now the second part, the scientific part of it, is to provide a forum that scientists, physicians, investigators come together to study the latest innovations, the latest breaking medical information about patients that have allergic and immunologic diseases.
And what are some of the highlights, things that you're particularly looking forward to hearing about while we're all here?
The major theme of our meeting this year is immune modulators. So the new drugs that are in development, that have been developed in the last 10 years, that are used to treat all types of allergic and immune-mediated diseases. We're highlighting those this year to try to help the practitioner as well as the researcher understand about those different types of medications, how they might work, how they're to be used, and what the side effects are of the medications.
And what drug classes are we talking about here?
We have of the immune modulators, there are monoclonal antibodies that have been developed. There are new small molecules that have been developed both by industry and academics to try to be used as immune modulators to try to modulate the immune system in some way to change disease process.
And do you expect that these drugs would have improved side effect profiles or better efficacy than what's already available?
I think what we've seen with the immune modulators that have come out in the last 5 years and those that are being developed is that the side effect profiles in the original diseases are better, but what we're also seeing is that those same immune modulators are being used in different diseases, and that's what part of the research is to take a monoclonal antibody that's been developed for one particular disease and understand then how it might work for another disease or diseases that can be used to treat those patients.
And I know the press conference tomorrow is going to focus on origins and etiology of asthma. Are we really getting closer now to figuring out exactly what is causing asthma and the increases in prevalence that we've seen in the last few decades?
I think we have a huge amount of information now about the origin of asthma, both the genetics as well as the environmental influences. And I think weekly the medical community learns more information and more data comes in to try to help us understand that asthma is a multifactorial disease. And I think the more that we understand, the more we know that there's a lot more to understand about it. The genetic studies that are coming in that will be presented at this meeting are fairly significant. The environmental studies that have come in and the interrelation between environmental factors on the genetics of that particular person, I think, are huge.
And other than asthma, what other diseases are we going to hear some interesting new things about here?
In addition to asthma, the major allergic and immunologic diseases that you would see at this meeting are allergic rhinitis, food allergy, atopic dermatitis, urticaria, primary immune deficiencies, children that are born without an immune system, such as severe combined immune deficiency, DeGeorge syndrome, diseases like that. All those you'll see the latest information from studies that would pertain to those types of patients.
And is there anything that you know of that's coming out here in any of those areas that you think are going to be practice changing?
I think one of the things that is in fact going on today is the Tigers meeting. This is a meeting that has brought together pediatric and adult gastroenterologists as well as pediatric and adult allergists and immunologists to talk about the eosinophil-related gastrointestinal diseases. These are diseases both in children and adults that the prevalence has hugely increased in the last 10 years. And it's brought together that community, and there are over 600 people attending the meeting today. And I think what that will do is will help in practice, give people a better way to diagnose those patients as well as a better way to treat them.
And you said TIGERS. Is that an acronym for something?
It's an acronym for an International Gastrointestinal Eosinophil Research Meeting.
I see. You said the prevalence of that or incidence of that has increased dramatically. It's still pretty much a rare condition, though, isn't it?
It's actually not rare now. The eosinophilic-related esophagitis, gastroenteritis, proctitis, those diseases are increasingly being seen in gastroenterologist as well as immunologist, allergist office. In fact, the meeting that I just left a few minutes ago, we had investigators as well as physicians from all four of those specialties coming together, talking, having presentations to try to help the whole community collaborate to develop better treatments, understand the disease better.
Right. Is there anything else you'd like our viewers to know about Quad AI?
I think one of the things that we've tried to do in the last several years is to bring in keynote speakers that 2 times during our 5-day meeting, that we have the whole community come together to have something presented of importance. One of the speakers this time is Sir Lord Winston, that's coming to talk about some of the debates about stem cells that really apply to all the different areas of medicine that we're talking about, all the different diseases, as well as both physicians, others in practice, as well as those doing research. I think it'll provide a good forum for dialogue.
And you have Arlen Specter keynoting at the meeting too, if I'm not mistaken.
Yes, our second keynote speaker on Monday is Senator Specter, and we've asked him to come to address our group in similar vein to Sir Lord Winston, in that we have the whole group come together. We have no other competing times of other information, other sessions going on at the same time. So he could talk to our group just about the issues that are pertinent both from the clinicians in practice as well as researchers, because there are a huge number of issues that the Congress faces to try to deal with all those.
I'm John Geaver, MedPage Today.